So in this video, I am discussing in communication, that is a recall communications. First, explain the management of atopic eczema to parents. Mother refuses the steroid cream. So it comes on 2019 that I will explain management of atopic eczema. Plus, here mother refused the steroid cream. Another, it comes on again 2019, that is anxious mother has 9-month-old baby with eczema, had one admission for eczema herpeticum. Eczema is still flares. Worried about the management of eczema and concerned about the probiotic breastfeeding only for 2 months. Disturbed sleep on hydrocortisone, PRN, and emollients. Mom concerned regarding steroid formula milk, poor knowledge. So we should need to answer of the question of the mother. Now, as usual, we are starting that IRCAP, introduce myself, making a report, taking the consent and the agenda telling and any attendance needed and prior knowledge I ask. So first, we are directly starting the management of eczema. What are the options? First, the management is avoid the triggers. So avoid anything that may increase the rest. Every child has its own features that will increase his rest. Some children increased with the certain types of soaps. Some children increase certain types of clothes. Some children increased with certain types of foods. Number two, nail care, very, very important. As frequent traumatizing himself, the rash will not improve. Number three is moisturizing cream because eczema caused by skin dryness, so we need moisturizing cream to keep it the moist all the time. Number four, if moisturizing cream not effective, we have to give him steroid cream. And number five, if steroid does not work, we can use the tacrolimus, that is a local immunosuppressive. So what are the options of management we will discuss? First of all, about trigger, we will tell that every child has his own trigger, like some has food, some has soap, special weather. These are we need to know that. Then we will take care of the nail because traumatize the skin. Number three, we will give the emollient use. If emollient not work, we will give the local steroid. Local steroid not work, then we give the tacrolimus, that is a local immunosuppressive. So this is the management. Now one by one, we will answer mother questions. Like mother asking why it happened to him. So why eczema occur? Because it is an overreactive defense system of unknown cause leading to inflammation of the skin, leading to skin sores which may be complicated by bug infections. So it happens because it is an overreactive defense system of the reactions. Inflammation of the skin occur. Overreactive defense system of the unknown cause leading to inflammation of the skin, leading to skin sores which may be complicated by bug infections. Now, what is meant by atopy? What is atopy? Atopy means that it has a tendency to any aspect of allergy like eczema, hay fever, and bronchial asthma. So, atopy is the condition where tendency of eczema, hay fever, these are rhinitis, these are. What are the causes of flare? Flare causes of flare up are the dust, heat, contact with the detergent, psychological problem, infection like bugs or virus, and dryness of the environment. So these causes flare up. What are the causes of flare up? That is any dust, any specific environment, any psychological problem, detergent, infection like bugs or viruses. Can it be cured? Actually, it cannot be cured, but there are many ways to control it. So eczema that is not cured, but many ways to be control that. Now about steroid, mom asking, I will not give him steroid. So we'll ask that, can I know why? Always we ask in communication, what about your concern? Because there is the hidden agenda present. So why you are not giving? Because steroid, it has many drawbacks. It may cause diabetes and hypertension, like that mother answering. Actually, I appreciate your worries, but let me reassure you that the concentration of the steroid in this cream is very, very tiny, and even the amount which absorbed in the circulation is negligible. So the risk of having these drawbacks, and meanwhile we will keep monitoring him. If anything happens, we will interfere immediately. So when mother denied about the steroid, I will not give him, we will ask why. Then we will tell that the amount of I understand your worries. We first appreciate, reassure that everything. Then we'll tell that the amount of steroid in this cream is very, very tiny and negligible, and it is if enter into the circulation very rare or no drawbacks. And also we are monitoring him; he is under monitor. If anything happen, we will interfere immediately. No, I'll not give him steroid, ma'am. If he needs steroid and you do not give it to him, he will not be able to sleep at night. He will be itching. It will affect his daily life. Are you with me? So, if not give the steroid, then what happen? We'll tell them that he will not sleep the night time. It increase his itching. These are affect his daily life. I will avoid the trigger and give him moisturizing cream. Mother is telling. Oh, that is great. But this is good start, and we will follow him up. And if he not improve, we may prescribe this steroid cream. And if you have any doubt, we can have a meeting with the skin doctor. He will explain you more about this. So it's really any treatment, any management. This really good start that avoid trigger, but avoid trigger will not alone improve him. So he need to we may prescribe a steroid cream, and if she has any drug, we arrange a meeting with the skin doctor. Then can I stop cortisone if flare up is stopped? No, better to continue after flare up of the settle down or 2 consecutive days or week for 3 to 4 weeks. So mother is telling if the flare is gone, control, then I can stop the hydrocortisone. No, 3 to 4 weeks we can continue. We'll tell that. So what are the drawbacks of the local steroid? Local steroid drawbacks, if mother asking, the answer is that may cause the thinning, depigmentations. But I will tell you some advices that will decrease these drawbacks. First, we put the ointment with the fingertips. Start from the mild to potent steroid and avoid thin skin areas like eyelids. So, local steroid side effects, it causes the thinness of the skin. So, we are giving first from the mild steroid, potent steroid. There are mild, moderate, and severe potent. We are giving mild potent steroid, and first we put the ointment with the fingertips. Start from mild to potent steroid, and thin area like around the eye we will avoid. Is it run in families? Yes, it is run in families. Could it grown up? Could it be grown out with him? Most of the children 6 year, other may at puberty. So 6 year or puberty it grew out. I heard that local tacrolimus causes skin cancer. Actually, this is academic research, not proven clinically, and we use it for a long time. We did not find any relation between the local tacrolimus and the skin cancer. So any skin cancer, anything that we have no any find any research like that. We are using long time, so we are not facing any problems. Are these drawbacks of the local tacrolimus? Are there any drawbacks of the local tacrolimus? So drawbacks of local tacrolimus are it may cause skin stinging sensation and the skin will be prone to infection. But to avoid this, we avoid the sun exposure after using this ointment. So local tacrolimus, we avoid the sun exposure. Remember, and I heard about the Chinese herbal medicine. Many people take it and proved. Okay, I do not know the ingredients of this Chinese herbal medicine. Also, concentration of these ingredients and response of these herbals are variable and not predictable. As well as these are the reported case of increased liver function test after using this herbal Chinese problem. So when any herbal medicine they offer that I have no any idea. First of all, I don't know what is the ingredient of these herbal medicines, but their outcome is not predicted. Number one, number two, there are these are reported as a case of increase the liver functions test. So liver they affect this herbal medicine, this Chinese medicine. Then as usual, do you have any other concern? Trusted website, leaflet, support group will add, and this is all about this atopic eczema. So atopic eczema directly management come and related with the mother refuse the steroid cream. Also mother disturbed sleep, so she needs to take the treatment. That's why the child is disturbing. So according to will answer that. So this is all about. Thank you very much.